Thank you, Chairwoman Eshoo. Thank you for all that you're doing today with these very important bills. I wanted to say that throughout the 117th Congress, the Health Subcommittee has been leading the charge to improve healthcare for all Americans. The COVID pandemic has not made it easy, we know, but I'm proud we're marking up 19 bills today that have all been agreed to on a bipartisan basis, and I greatly appreciate the Republicans for working with us to get to this point. I just wanted to review some of them. I know you've heard already from the chairwoman about the bills that we're considering, but I wanted to mention that several things. That first, the legislation that supports development of advanced pharmaceutical manufacturing technologies. We also have the ones on opioids and substance abuse. We have the one on social determinants of health, which is also very important. We have the bill that improves maternal health. Others that increase access to life-saving vaccines, and of course, very important, the bill that avoids the devastating Medicaid fiscal cliff for Puerto Rico and the other U.S. territories. My legislation, which the Ranking Member Guthrie mentioned, that creates a Centers of Excellence program to foster the development of advanced and continuous pharmaceutical manufacturing technology. This is bipartisan with Mr. Guthrie, and leads to a more nimble and efficient mode of drug production by expanding opportunities for the FDA to partner with universities around the country that are leading these efforts. Then we have a series of bills that tackle the opioid epidemic with resources and training to providers and organizations on the ground. And these proposals help people across the country who are battling substance abuse and also, particularly now during the worst pandemic. Just yesterday, the Centers for Disease Control announced that more people died of overdoses last year than any year on record. And so these bills are another step in our efforts to combat this devastating epidemic, again, bipartisan. We also have several bills that augment our public health data infrastructure. Maybe sounds boring, but it's actually very important because these proposals would increase our understanding of health inequities and the social determinants that contribute to worse health outcomes for many communities. And then they have multiple pieces of legislation that increase access to vaccines for all Americans. During our legislative hearing on public health and vaccines, health experts estimated that millions of people across the country have missed routine vaccinations, not just COVID, but in general, because of the barriers posed by the pandemic. Additionally, the COVID pandemic has underscored the need to strengthen our nation's vaccine infrastructure, address vaccine hesitancy, and expand access to vaccines. So if we don't act to get people put up, we're going to face a wave of unnecessary illnesses and death from diseases that really are preventable. And they also wanted to mention a number of bills that will improve maternal health outcomes, including the Maternal Health Quality Improvement Act introduced by Representatives Kelly and Bouchon, again bipartisan, addresses the nation's maternal mortality crisis. And that's been a priority for this committee. I'm proud this markup moves forward on this. And last, we have the legislation that was mentioned to avert a fiscal cliff for American citizens who rely on Medicaid in Puerto Rico and U.S. territories. This bipartisan agreement extends the increased funding caps and federal medical assistance percentage, or FMAP, for 5 years for Puerto Rico, 8 years for U.S. Virgin Islands, Guam, American Samoa, and the Northern Mariana Islands. And again, I want to thank Ranking Member Rogers for her commitment on this issue, as well as all the representatives of U.S. territories for their efforts and advocacy on behalf of this bill and their constituents. This is the longest extension of increased Medicaid funding for the U.S. territories other than the one we had in the original Affordable Care Act. And I remain committed to a permanent funding solution for the territories. But this is a very strong bill worthy of bipartisan support. And we're going to continue to work with Ms. Rogers to get this bill signed into law, passed the Senate, signed by the president. Lastly, just want to thank again Chairwoman Eshoo, Ranking Member Guthrie, Ranking Member Rogers, and all the sponsors of today's bills for their commitment to strengthen healthcare for the American people. And I know that this subcommittee, Madam Chair, will continue to work together with us to solve very pressing issues that face the country. All of these fall into that category. I yield back. Thank you again.